Welcome to our talk about understanding trauma. This presentation is put together by Trinity Services Incorporated. Today, we're going to talk about what trauma is, the different kinds of trauma, how it affects people, and ways to heal from it. Our goal is to help you understand trauma better so you can support yourself and others when dealing with tough times. Let's go on this journey together, learning more and becoming more caring toward those who have been through trauma. Thanks for being here. Let's get started. Trinity Services Incorporated is a multifaceted nonprofit organization dedicated to serving diverse populations, including individuals with intellectual and developmental disabilities, those experiencing mental health crisis or diagnosed with mental health conditions, school children, and individuals experiencing homelessness. This presentation is designed to be comprehensive to effectively address the needs of the diverse staff at Trinity Services Incorporated. This includes, but is not limited to, independent living coaches, program coordinators, job coaches, team leaders, residential coordinators, directors, administrative personnel, mental health professionals, school personnel, and first responders who provide initial support to individuals in crisis. In this presentation, we will cover key aspects of trauma and its impacts. Our objectives include understanding the body's response to stress, which can occur when we face challenges or threats. We will discuss the different levels of trauma, such as acute, chronic, and complex, and gain an understanding of trauma in individuals with intellectual and developmental disabilities. Our discussion will also include information on post-traumatic stress disorder symptoms and its diagnosis and how it differs from other responses. We will explain how treatments help people cope with trauma and enhance their well-being. Finally, we will address vicarious trauma, which affects those who work closely with trauma survivors, such as healthcare workers, first responders, and counselors. The signs and impact on caregivers will be shared as well as strategies for self-care and support. At the conclusion of this presentation, you will have a better understanding of trauma, its effects, and how to support those directly affected, including yourself. Stress is a natural response to challenges or threats and is essential for survival. It's the body's natural reaction to demands or pressures, whether physical, emotional, or psychological. It's how we respond to situations we perceive as challenging or threatening, triggering a range of physical reactions to help us handle immediate threats. When faced with stress, our bodies undergo a series of changes known as the stress response or fight or flight response. Let's dig into the various types of stress in the next few slides. It's important to know that not all stress is the same. We can categorize stress into three main types: acute stress, episodic acute stress, and chronic stress. Acute stress is short-term and happens because of specific events or situations, like narrowly avoiding an accident or preparing for a big presentation. It is usually intense but resolves quickly. Episodic acute stress occurs when someone often experiences episodes of acute stress. For example, People with demanding jobs or very busy lives might face this type of stress regularly. Chronic stress, on the other hand, is long-term and can result from ongoing pressures such as financial difficulties, chronic illness, or a stressful work environment. Unlike acute stress, chronic stress can have lasting, harmful effects on both physical and mental health. While acute stress can be helpful in small doses, chronic stress can severely impact our health. Being under stress for a long time can lead to serious health problems. It can increase the risk of heart disease and high blood pressure. It can cause anxiety and depression, weaken the immune system, and lead to digestive problems like irritable bowel syndrome and ulcers. This is why it is important to manage stress effectively and find ways to cope with long-term pressures. Managing stress is crucial for maintaining both physical and mental health. Effective strategies include regular exercise, which helps lower stress hormones and boost mood, relaxation techniques such as deep breathing, meditation, and yoga can calm the mind and body. Adopting a healthy lifestyle by eating a balanced diet, getting enough sleep, and limiting alcohol or drug use is also important. Additionally, social support from friends, family, and support networks can provide emotional relief and a fresh perspective. Prioritizing tasks and setting realistic goals can help reduce feelings of being overwhelmed through effective time management. Understanding how stress impacts us is the first step in managing it effectively. As we mentioned, there are times when stress can be good for you. Eustress, or positive stress, occurs when we face challenges that we perceive as manageable or within our control. It is associated with feelings of excitement, motivation, and fulfillment, which helps us to push our boundaries and achieve personal growth. Eustress can enhance performance and productivity by improving focus and concentration, which leads to better performance and efficiency. For instance, the stress of an upcoming deadline can motivate us to work efficiently and creatively. Positive stress also boosts energy and motivation by triggering the release of adrenaline and other hormones, making us feel more alert and ready to act, which is especially useful in activities that require quick thinking. Competitive sports or public speaking are two. Moreover, eustress can improve resilience and adaptability. Overcoming challenges builds resilience, enhancing our ability to cope with future stressors. It encourages adaptability and helps develop problem-solving skills, making us more capable of handling change and uncertainty. Stressful experiences, such as learning new skills or taking on leadership roles, can promote personal growth, boosting confidence and expanding our horizons. Additionally, short-term stress, such as physical exercise, can improve overall health. Taking on new responsibilities at work or pursuing higher education can be stressful, but often leads to career advancement and personal growth. These challenges offer opportunities for learning and skill development, contributing to long-term success. Setting and reaching personal goals, such as completing a marathon or learning a new language, involves stress but results in a strong sense of achievement and self-worth. These experiences boost self-image and confidence. Major life events like getting married, having a child, or moving to a new home can be stressful, but are often associated with joy and excitement. These milestones contribute to a richer and more fulfilling life. To benefit from stress, it's essential to find the right balance. Too little stress can lead to boredom and lack of motivation, while too much stress can cause anxiety and burnout. Aim to seek challenges that are stimulating yet manageable, and avoid overwhelming situations. View challenges as opportunities for growth rather than threats. Shift your perspective to see stress as a natural and beneficial part of life. By adopting a positive mindset, you can turn stress into a powerful tool for personal and professional development. In conclusion, while stress often has a negative reputation, certain types can be beneficial. By understanding and harnessing positive stress, we can enhance performance, boost resilience, and achieve personal growth. In the next section, we will explore the more severe impacts of stress, including trauma and PTSD. When we have stress for a long time, it can change our brain in big ways. For example, it can make a part of our brain called the hippocampus smaller. The hippocampus helps us remember things and learn new stuff. If it gets smaller, it can be harder for us to remember and to learn. Another part of the brain, called the prefrontal cortex, helps us make decisions and control our impulses, like not eating too much. Long-term stress can also cause this area of the brain to shrink, making it harder for us to plan, focus, and stay calm. There is also a part of the brain called the amygdala that deals with feelings like fear. The amygdala can increase in size due to chronic stress, which may make us feel more anxious and emotional. Experiencing chronic stress can also disrupt the balance of chemicals in our brain, like serotonin and dopamine. These chemicals help us to feel happy. If they become imbalanced, we may feel increased sadness and worry. Finally, long-term stress can stop our brain from making new brain cells, especially in the hippocampus. This makes it harder to think clearly and deal with stress. Stress can also change how different parts of the brain talk to each other, which can make it hard to pay attention, solve problems, and make good decisions. This makes it tough to think clearly and handle challenges well. In this section, we will simplify the concept of trauma to make it easier to understand. We will describe the various types of trauma, such as acute, chronic, and complex, and discuss their impacts on individuals. Additionally, we will explore who is most affected by trauma and why certain groups might be more vulnerable. Our goal is to provide a clear overview that helps you better grasp how trauma can influence people's lives and why it is important to recognize and address its effects. Trauma is an emotional response to an event that is so distressing or disturbing that it overwhelms a person's ability to cope. It can involve actual physical harm or the threat of harm to oneself or others, often causing intense feelings of fear, helplessness, or horror. Trauma can come from a single event, like an accident or assault, or from ongoing stressors, such as abuse or neglect. Trauma can be categorized into different types based on the nature and duration of the traumatic experience. Acute trauma results from a single, often unexpected event, such as an accident natural disaster, or violent attack. On the other hand, chronic trauma involves prolonged exposure to stressful or traumatic events, such as ongoing abuse, domestic violence, or experiences of combat. Each type of trauma can have profound and lasting impacts on an individual's mental and emotional well-being. Trauma uniquely impacts various groups, affecting mental health, social well-being, and resource access. Children face behavioral and academic challenges due to developmental vulnerability. Individuals with intellectual and developmental disabilities are at a higher risk due to communication barriers and dependency. Military personnel often suffer from combat-related PTSD and need specialized support. First responders encounter trauma frequently, risking burnout and PTSD. Low socioeconomic status leads to higher trauma exposure and health issues, requiring accessible mental health services. Pre-existing mental health conditions are often worsened by trauma, necessitating integrated care. Minority groups face systemic discrimination, highlighting the need for culturally competent care. Targeted interventions are essential for fostering resilience in these communities. The impact of trauma is significantly shaped by the developmental stage at which it occurs, influencing how individuals respond and adapt to traumatic experiences. Trauma can disrupt normal developmental processes, affecting cognitive, emotional, and social growth, particularly in children and adolescents who may struggle with forming secure attachments, developing self-regulation skills, and achieving developmental milestones. This disruption can lead to delays or deviations in emotional and psychological maturation, resulting in behavioral problems, emotional dysregulation, and challenges in academic or social settings, with long-term implications for mental health, relationships, and overall well-being. Young individuals who experience trauma are also at a higher risk of engaging in self-injurious behaviors such as cutting or substance abuse as maladaptive coping mechanisms. Early intervention and therapeutic support are critical for addressing underlying trauma and reducing these risks. Additionally, childhood trauma often leads to compulsive reenactments of the traumatic experiences, known as re-traumatization, which can manifest through repetitive behaviors, relationships, or situations similar to the original trauma. Understanding these patterns is essential for identifying triggers, addressing unresolved trauma, and promoting healing. Recognizing the impact of trauma based on developmental stages allows for trauma-informed care that addresses specific developmental needs and supports healthy coping mechanisms. Let's look at how trauma affects individuals with intellectual and developmental disabilities. Let's focus on their unique considerations, impacts, and misconceptions. It is crucial to understand these factors to provide effective support and intervention for individuals with intellectual and developmental disabilities who have experienced trauma. Research indicates that individuals with intellectual disabilities have higher rates of PTSD compared to the general population, largely due to their unique vulnerabilities, communication challenges, and difficulties in processing and expressing emotions. Contrary to popular belief, being institutionalized does not necessarily increase the risk of PTSD. Instead, children and adults with intellectual and developmental disabilities living in family settings show similar PTSD rates, suggesting that quality of care and support is vital in trauma exposure and recovery. Individuals with ID may also experience PTSD symptoms for events not typically seen as traumatic, with their perception and responses to stressful events often differing due to cognitive and communication challenges, necessitating tailored trauma assessment and intervention approaches. Additionally, those with ID are more likely to experience distress following stressful events, even if those events aren't classified as traumatic, highlighting the need for supportive environments, understanding behaviors as stress indicators, and implementing trauma-informed care practices. Understanding these unique needs and vulnerabilities is essential for delivering compassionate and effective support to individuals with intellectual and developmental disabilities. Individuals with disabilities often face unique challenges and vulnerabilities that can expose them to various forms of trauma, including neglect, physical abuse, emotional abuse, and sexual abuse. Neglect can manifest as inadequate care, lack of access to necessary medical and educational services, and general disregard for their well-being, often leading to feelings of abandonment and isolation. Physical abuse may include acts of violence or restraint, which can leave both visible and invisible scars. Emotional abuse can be particularly damaging, encompassing verbal harassment, belittlement, and manipulation, which can undermine an individual's self-worth and psychological health. Sexual abuse remains a grievous concern, as individuals with disabilities may be seen as easy targets due to perceived power imbalances and communication barriers. This results in profound and lasting trauma. Understanding and addressing these forms of abuse is crucial in providing a safe and supportive environment for individuals with disabilities. In this section, we will provide an overview of post-traumatic stress disorder, PTSD, exploring its symptoms, causes, diagnoses, and impact on individuals' lives. PTSD is a complex psychological condition that can develop after exposure to traumatic events. Let's delve into the key aspects of PTSD to gain a deeper understanding. Post-traumatic stress disorder, or PTSD, is a mental health condition that can develop in individuals who have experienced or witnessed a traumatic event. These events can include natural disasters, accidents, physical or sexual assault, combat, or other situations that pose a threat to life. Factors that can increase the risk of developing PTSD include the severity of the trauma, personal vulnerability, lack of social support, and having experienced previous traumatic events. These elements can significantly influence how a person responds to and recovers from traumatic experiences. Individuals with PTSD often experience a range of symptoms that can significantly impact their daily lives. Re-experiencing symptoms include distressing memories, nightmares, or flashbacks of the traumatic event, which can be triggered by reminders, leading to intense emotional and physical reactions. Avoidance symptoms may manifest as efforts to avoid thoughts, feelings, or situations that remind the person of the trauma, including avoiding places, activities, or people linked to the event. Hyperarousal symptoms involve feelings of constant heightened alertness, difficulty sleeping, irritability, and exaggerated startle responses. This makes it hard for individuals to relax or concentrate. Additionally, PTSD can cause negative changes in mood and cognition, such as persistent negative beliefs about oneself or the world, feelings of detachment from others, or difficulty experiencing positive emotions. These symptoms collectively affect an individual's ability to function and find peace in their daily life. Let's delve into some important facts about PTSD to better understand its impact and prevalence in society. Firstly, it's estimated that about 3.5% of the population may experience PTSD within any given year. This statistic highlights the widespread nature of the disorder and the importance of awareness and intervention. PTSD occurs at higher rates among veterans and individuals who are at greater risk of trauma exposure. This includes people who have experienced combat, natural disasters, serious accidents, or violent personal assaults. The exposure to these traumatic events increases the likelihood of developing PTSD, making targeted support for these groups especially crucial. Also, PTSD is more prevalent among females than males. Studies have shown that women are more likely to develop PTSD following a traumatic event. Though the reasons for this difference are complex and can include biological, psychological, and social factors. Understanding these facts is essential for recognizing who might be at a higher risk for PTSD and the need for tailored approaches to prevention and treatment. In our next section, we will explore strategies and interventions that can help those affected by PTSD to manage their symptoms and improve the quality of their life. Trauma-informed care is an approach that recognizes the widespread impact of trauma on individuals and emphasizes the importance of understanding its effects on health and behavior. It involves creating a safe and supportive environment where individuals feel empowered and respected. Trauma-informed care encourages caregivers to recognize signs of trauma, avoid re-traumatization, and promote healing by integrating knowledge of trauma into all aspects of caregiving. This approach fosters resilience and recovery, leading to more effective and compassionate treatment outcomes. In this section, we will cover the definition, why trauma-informed care is important, and guiding principles and core steps of care. Trauma-informed care is a set of principles designed to guide the delivery of treatment based on an understanding of the needs of individuals who have experienced trauma. These principles prioritize creating a comfortable and safe environment for the individual before any treatment is administered. Trauma-informed care principles are widely applied across various settings, including hospitals, behavioral health services, and government programs, ensuring that care is both compassionate and effective. The trauma-informed care approach represents a significant evolution in the treatment of individuals with mental health and trauma histories, marking a future-forward progression from a time when lifelong institutionalization was often the standard for those with mental health challenges. This shift acknowledges the profound long-term effects of abusive treatment and traumatic experiences on individuals' well-being. Trauma-informed care emphasizes the importance of understanding and valuing each person's unique history and current needs, fostering a supportive and compassionate environment that promotes healing and recovery. By recognizing the pervasive impacts of trauma and prioritizing the safety and empowerment of individuals, trauma-informed care not only enhances the quality of care, but also underscores a societal commitment to dignity, respect, and the intrinsic value of every person. This approach is increasingly being integrated across various settings. This includes healthcare, education, and social services, reflecting a more humane and effective model for addressing the complexities of trauma and mental health. The 6 guiding principles of trauma-informed care are designed to create a supportive and healing environment for individuals who have experienced trauma. First, safety ensures that both physical and emotional security are prioritized. Trustworthiness and transparency involve open and honest communication to build trust between providers and individuals. Peer support emphasizes the importance of mutual help and shared experiences in the healing process. Collaboration and mutuality highlight the need for partnerships and shared decision-making in care. Empowerment, voice, and choice focus on empowering individuals by honoring their perspectives and encouraging self-advocacy. Lastly, cultural, historical, and gender issues address the need to understand and respect diverse backgrounds and experiences, promoting inclusivity and equity in care practices. Trauma-informed care is guided by 4 core steps: realize, recognize, respond, and resist re-traumatization. Realize involves understanding the widespread impact of trauma and acknowledging its potential to affect anyone, thereby laying a foundation for empathetic and effective care. Recognize entails identifying the signs and symptoms of trauma, such as anxiety, withdrawal, or hypervigilance. This helps in providing appropriate support and avoiding misunderstandings. Respond focuses on integrating trauma knowledge into all aspects of care, fostering a supportive environment that emphasizes trust, safety, and collaboration. This step involves adapting policies and practices to encourage respectful, empowering, and non-judgmental interactions. Finally, resist re-traumatization aims to prevent the recurrence of trauma by creating safe environments and avoiding practices that could inadvertently cause distress or trigger trauma responses. Together, these steps form a comprehensive approach that ensures care is sensitive to the needs of individuals who have experienced trauma, promoting their recovery and well-being. Trauma-informed care encompasses several guiding principles, some clearer in their application than others. For staff members, embodying a trauma-informed approach hinges on 2 primary distinctions. First, it involves the proactive assessment of trauma among the individuals they interact with, recognizing its potential impact on behavior and well-being. Second, it entails the creation and maintenance of environments that prioritize safety, trust, and empowerment, aiming to minimize re-traumatization and foster healing. These practices not only enhance sensitivity to trauma, but also support individuals in feeling secure and understood within their interactions and surroundings. Let's talk about how we can modify environments to support individuals with PTSD. Creating a safe and calm environment is essential for reducing stress and promoting healing. Here are some key considerations for making these modifications. Minimizing triggers is one critical aspect. Triggers can be anything that reminds the individual of the traumatic event, leading to anxiety or flashbacks. By identifying and reducing these triggers, we can help decrease the likelihood of distress. This could involve adjusting the layout of a room, removing certain items that may cause discomfort, or making changes to daily routines. It's also important to consider the volume and tone of voice used in the environment. For someone with PTSD, loud noises or harsh tones can be particularly unsettling. Using a calm, gentle voice and maintaining a peaceful atmosphere can help individuals feel more secure and less on edge. Establishing routines can provide a sense of predictability and control, which can be very comforting for individuals with PTSD. Routine activities such as regular meal times, consistent sleep schedules, and planned leisure activities can help reduce anxiety and improve overall well-being. Developing good rapport with others is equally important. Building trust and a supportive relationship can make a significant difference in how comfortable someone feels in their environment. This can be achieved through active listening, showing empathy, and being consistent and reliable in your interactions. Finally, making these physical accommodations to the environment is important. Small changes can have a big impact on how safe and supported an individual feels. By making these environmental modifications, we can create a supportive and healing space that aids in the recovery process. When supporting individuals who have experienced trauma, care workers need to be mindful of several key considerations to provide effective and compassionate care. It is essential to recognize the signs and symptoms of trauma, including anxiety, depression, and PTSD, and to understand how these can manifest in different individuals. Care workers should be trained in trauma-informed care, which involves creating a safe, supportive, and non-judgmental environment that respects the individual's experiences and promotes healing. It is also important to be aware of the potential for re-traumatization, which can occur if practices are not sensitive to the individual's past experiences. Care workers should ensure clear communication, maintain appropriate boundaries, and be patient, as recovery from trauma is often a gradual process. Additionally, care workers should be prepared to provide or facilitate access to resources such as mental health support, counseling, and community services, and to support individuals in developing coping strategies and resilience-building skills. Regular supervision and self-care are also crucial for care workers to manage their own stress and prevent burnout while providing ongoing support to those in their care. Vicarious trauma refers to the emotional residue that caregivers, therapists, and other professionals may experience as a result of their work-related exposure to clients' trauma stories. This can occur through various means, such as listening to clients recount their traumatic experiences, watching videos with distressing content, reviewing case files, or responding to the aftermath of violence and other traumatic events, including natural disasters. Vicarious trauma can profoundly affect a care worker's emotional well-being, leading to symptoms such as anxiety, depression, and feelings of helplessness. It is crucial for professionals to recognize the signs of vicarious trauma and take proactive measures to mitigate its impact. This might include seeking supervision, participating in peer support groups, practicing self-care and setting healthy boundaries to maintain their own mental health while providing support to others. Vicarious trauma can manifest through a range of symptoms that affect both the emotional and physical well-being of professionals exposed to traumatic content. Common signs include altered eating or sleeping habits, somatic symptoms such as headaches or digestive issues, and difficulty concentrating. Individuals may find themselves unable to stop thinking about their work and clients, feeling trapped by the demands of their job. This can lead to diminished feelings of satisfaction and increased levels of anxiety, sadness, and irritability. Professionals may also experience feelings of hopelessness, believing that they aren't doing enough for their clients, which can contribute to a sense of isolation. In some cases, individuals may turn to increased alcohol or substance use as a coping mechanism. Recognizing these symptoms is crucial for taking steps to address and manage vicarious trauma effectively. Managing vicarious trauma effectively requires implementing several key strategies to protect the well-being of care workers. Establishing a consistent work-to-home transition can help individuals leave work-related stress behind and maintain a healthy boundary between their professional and personal lives. Regular check-ins with coworkers can provide mutual support and reduce feelings of isolation. Debriefing sessions are also valuable for processing traumatic experiences and discussing emotional reactions with peers. Rotating through different job assignments throughout the day can prevent burnout and reduce exposure to highly distressing content. Additionally, being aware of any counseling services provided to staff can offer professional support and guidance. It's essential for individuals to monitor their own emotional and physical health regularly, seeking help and taking breaks when needed to maintain their well-being and continue providing effective support to clients. As we end the presentation, we want to highlight self-care strategies. Self-care is essential for maintaining mental and physical well-being, especially for those in high-stress environments. Incorporating mindfulness practices can help individuals stay present and reduce anxiety. Following a consistent routine can provide structure and a sense of control, which is beneficial for mental health. Staying hydrated is crucial for overall health, so drinking plenty of water is highly recommended. Engaging in healthy coping strategies such as talking with friends, hobbies, or relaxation techniques can help mitigate stress. Regular physical activity is another effective way to boost mood and energy levels. Maintaining a routine sleep schedule is vital for recovery and overall health as well. Frequent check-ins with oneself and others can help monitor stress levels and emotional well-being. Finally, it's important to remember to take breaks and allow time for rest and relaxation to recharge and prevent burnout. Thank you for taking the time to watch our recorded presentation on trauma. We appreciate your interest and commitment to learning about this important topic. Your support helps us continue to make a positive impact.